let's talk about a huge question. Where do healthcare breakthroughs really come from? We're going to pull back the curtain and look at the real sources of innovation that are shaping how we heal and live.
When I say medical innovation, what's the first thing you picture? Is it that lone scientist in a lab having some big eureka moment? Yeah, that's the classic image, but the real story is so much more complex. And honestly, it's way more interesting.
The thing is, healthcare innovation isn't just one big event. It's more like a living, breathing ecosystem. It's this constant dance between powerful forces. So today, we're going to break down the 4 key engines that are always pushing healthcare into the future.
All right, let's jump into our first source. This is the one most of us probably think of right away. This is the technology engine, where brand new tools create possibilities that, well, just didn't exist before. And you can't talk about new tools without talking about artificial intelligence. This isn't science fiction anymore. It's a seriously powerful tool that's helping doctors right now, especially when it comes to seeing things the human eye might miss. AI is completely changing the game in medical imaging. We're talking about deep learning algorithms that can scan X-rays and CT scans and spot tiny, subtle abnormalities with incredible accuracy. I mean, in some cases, these AIs can perform at the same level as a seasoned radiologist. They're like the ultimate second opinion, helping to make diagnoses that much more certain. But the technology engine isn't just humming away in a hospital. It's getting a lot closer to home. In fact, for a lot of us, it's literally right on our wrists. Yep, I'm talking about wearable devices. Just think about it for a second. Smartwatches, sensor patches, even smart clothing. These things are packed with sensors that track our vital signs. And not just during a 15-minute doctor's visit, but continuously, 24/7. This flood of data is helping shift healthcare from being reactive, treating us when we're sick, to being proactive and even preventative. This tech engine is also just shattering physical barriers. And one of the best examples of this has to be the explosion of telemedicine. By using something as simple as video chat, telemedicine lets you have a full consultation with your doctor or a specialist from your living room. This is a total game changer. It's massively expanding access to care for everyone, but especially for folks in rural areas who might be hours away from the nearest clinic. Okay, so technology is amazing, but it's not the whole story. Let's shift gears and look at our second engine. And this one doesn't come from a lab. It comes from the very people the system is supposed to serve. Us, the patients. Think about your own experiences with the healthcare system. What happens when you get frustrated? When things are confusing or inconvenient? That feeling, that demand for something better, that is an incredibly powerful driver of change. This quote just nails it. Patient frustrations aren't just complaints floating in the wind. They are a powerful spark. They're basically giant blinking signs telling innovators exactly what problems need to be solved next. So what are these frustrations? Well, patients with chronic conditions are asking for better tools to manage their own health. We're all demanding more convenient care, which is a big reason telemedicine took off. We're sick of confusing bills and clunky appointment systems, and more, patients want a seat at the table, a real voice in their own treatment decisions. All of these demands are pushing the industry to evolve. So we've got technology and patient needs. Now, for our third driver, these are the innovations that bubble up from the inside, from the doctors, nurses, and staff on the front lines who are trying to fix systems that just aren't working. Take a problem that every single doctor or nurse knows all too well: the mountain of paperwork. The before picture was ugly. Hours of manual note-taking, often late at night after the last patient had gone home. The after is where provider-driven innovation comes in. They created tools like structured templates that make capturing vital information way faster and more efficient. And that frees them up to focus on what actually matters: you, the patient. And it definitely doesn't stop there. Providers are the ones using data to figure out how to optimize clinic schedules to cut down those awful wait times. They're also building new communication tools to make sure your primary doctor, your specialist, and your pharmacist are all on the same page. It's all about making care safer and more coordinated. All right, time for our fourth and final engine. This one comes from the top down. It's the powerful push from government policy and regulations. These are the rules that create the incentives and requirements that can shape the entire industry. You can see a really clear cause and effect here. When the U.S. government mandated electronic health records, it caused a massive boom in the health IT industry. When a country like Indonesia launches its Satu Sehat initiative, forcing different systems to actually talk to each other, it sparks a wave of new interoperable tech. And when payment models change to reward good outcomes instead of just more procedures, it forces providers to invent entirely new ways of delivering care. Policy really does set the rules of the game. So the big takeaway here is that none of these engines works alone. They're all part of this single interconnected innovation ecosystem. A new technology might create a cool new tool, but it's patient needs that decide if anyone actually uses it. Provider workflows then refine how that tool gets used in the real world, and government policy can either hit the accelerator or the brakes on its adoption. They're all constantly influencing each other. And that brings us to one last thought to leave you with. As you look at the future, which of these four powerful forces, technology, patient needs, provider workflows, or policy, do you think is going to have the biggest impact on your healthcare? The answer to that is going to define the world we're all living in tomorrow.